Hello, my name is Michael Cercasov. I'm in charge of the health project in Haiti, Boukan, and I would like to tell you something about cholera. Cholera is not the main topic of the seminars in Grand Boukan in Haiti, because the health volunteers have been trained very well from America Solidaria. So I will make more like an update or a short summary of the illness. But I think for us participants, it's an interesting topic because, probably for the most of us, it's the first time we have contact with this illness or we heard of this illness. So some facts for you and why we don't have to be afraid of it. I took this pictures from PowerPoint out of the training of trainees on cholera epidemic session, and it was made by, as you can see down, it was made by the US Department of Health and Human Service, and it was made especially for Haiti. It was made in 2010. This was the major outbreak of cholera, and so there have been lots of efforts to train people, to train this health volunteers. And yeah, these are also only some extracts of a much bigger summary. Okay, so let's start with the enemy, the microbe that causes cholera. So there are a lot of Vibrio cholera microbes, but only the 01 microbe is the dangerous one, the one who makes the illness cholera. Yes, for the more scientific interested people, a little startup of how it works. This is our intestine. Here you can see the microbes coming in. And the microbes, they produce some toxins which attaches to the wall of our intestines. And it activates an ATP and CAMP cascade. And the most important thing, it makes a secretion of chloride from the external, from the blood, and during to the intestine, and it makes less absorption of sodium, and this means all the water we have in our body follows the salts, the chloride, and this makes watery stool with sodium and potassium, chloride and bicarbonate. So how did it appear? How is the clinical presentation? And the most important thing is dehydration, diarrhea, illness with loss of fluid and electrolytes. And it's such a massive loss that if you are not very aware and you don't get a proper treatment, you can lose more fluid than you can drink, and you will die on dehydration. This is here on the right. This is stool, so it doesn't look brown or like stool anymore. It's more like ricey water, so you lose poor water. You have severe and moderate cases. We will see them later on because this is important for the treatment. You have profuse water diarrhea. You have vomiting, and you have leg cramps. That's in a later state. This is because of the hypokalemia. The symptoms range from asymptomatic infection. This means people don't get ill at all, but their faecia can make other people ill. So that's an important thing later on for prevention. You can have a mild diarrhea, so you won't think of cholera, you just think, oh, it's a normal travel illness, and it can get to severe hypovolemic shock and also to death. The modes of transmission are important for us because that's how it helps to prevent, or if we know when we can do a good prevention of the illness. The transmission is mostly by water or food contaminated with Vibrio cholera 01 from human faeces and environmental reservoirs. These are people who don't feel ill, but in their feces they have this Vibrio cholera, this bacteria. Good thing is it's not not transmitted from person to person, so you don't have any health risks by helping cholera patients. You just have to be very careful if you deal with faeces and wash your hand, and also the disinfection of the place is very important. So the person who is in charge of the disinfection is mostly as important as the doctor and nurses who are working at these places. Here are some typical ways of or places for transmission. Like here you can see it's an unprotected water source. Open water, or on the right, in the back you can see the wall and some water is coming out. Nobody knows if it's contaminated or not, yeah, and people just take a drinking water. Also on the market, you can see the smiling child, if he hadn't washed his hand, for example, and he went to the toilet before, there could be a transmission of cholera. The documented vehicles of cholera transmission. So a summary, like I told you, the most important is water. In river water, also bottled water, if it's not, if the bottle was opened before, so if you buy bottled water, just take care that it's really sealed good. Also ice, so don't drink too much caipirinha. The second thing is seafood, but only raw seafood like oysters or clams, raw fish, or undercooked crab. So fish should all the time be cooked very careful and very good. Yeah, others, it's also leftover rice, everything that's left over, that's not in the refrigerator, old food. So take care, what you eat, and raw vegetables also, frozen coconut milk. Yeah, just take care. Later on we'll see some advice for travelers. Yeah, the plans. Now the assessment of the hydration status, that's important, because there's another treatment of the different states. And that's also for the health personnel very important to know moderate or severe cases of dehydration. So here is some good advice how you can see the difference between these two. So here it's the moderate dehydration. This means a loss of 5 to 10% of the body weight. You have normal blood pressure, normal pulse. The person are restless and irritable, sunken eyes. You have dry mouth, or you see dry mouth and tongue, increased thirst, and the person drinks eagerly. Skin goes back slowly after the skin have been pinched. You will see a picture later on. At babies, you could remark decreased tears and a depressed fontanella. And now the severity is more than 10% loss of body weight. The person is in shock, in hypovolemic shock. This means low blood pressure, rapid, weak and undetectable peripheral pulse, and minimal or no urine. Skin has lost this normal turgor, so you can see a tenting if you pinch the skin. Mouth and tongue are very dry. Sunken eyes, especially a child, you could see this. And the mental status is dulled. So people are very tired, they don't speak too much. Here's a picture. This is a tenting we described before. So if you pinch the skin, it will stay like this. And this is a severe dehydration, for example. How do you treat cholera? And the most important point is the hydration therapy. If people get enough drink enough, you can reduce mortality to less than 1%. This means person don't have to die if you really take care that they drink a lot. This is necessary for about 1 to 3 days. If you survive this phase, then you can regenerate and get healthy like before. So the oral therapy is the most important thing. With oral rehydration salts are recommended. 80 to 90% of patients can be treated with this oral rehydration salts, and patients require IV can soon switch to oral rehydration salts. So this is only for a short time. Persons need intravenous therapy. You can do this with ringer, but that's not so important for us. For us, it's with oral rehydration. It's the most important point. That's why America Solidaria also installed near Boukan an oral rehydration point where ill people could come and where they get this oral rehydration salts, and nurses and stuff take care that they drink enough. You can see how these oral rehydration salts are made, and yeah, Boukan has also delivered with the salts by America Solidaria. So there we can see this packages live. And now a person with mild dehydration gets to drink a lot, and they have to drink like this liter you see, they have to drink it in 1 hour. So they have really to drink a lot because they also lose this amount of fluids. Signs of adequate rehydration are skin goes back to normal when pinched. First has subsided and urine has been passed. Pulse is strong. Now the advice for the area affected by epidemic cholera. Yeah, like you could read in Every Lonely Planet, don't drink unboiled or untreated water. Carbonate drinks without ice are safe. So that's good for Coke, for the industry. Avoid food and beverage from street vendors. Avoid raw and undercooked seafood, as we heard before. Eat foods that are cooked and hot, and fruits you peel yourself, and also that are fresh. So the phrase is boil it, cook it, peel it, or forget it. The last picture, that's Jena, that's the town where I live. Yeah, it would be nice to see you once here. And yeah, thank you for your attention. That was a little session about cholera. Have a nice day. Bye.